Thank you, Mr. Chair. My question first off for Mr. Brower, how many employees do you currently have?
In the United States?
Yes. Well, no, actually, you know what? That was originally my question, but since we're dealing with Arkansas, how many employees do you have in Arkansas? It would probably be more appropriate.
About 24,000.
About 24,000. Are you, and with your focus on healthcare of the employer, surely you've looked into some of the side effects of the vaccines itself, is that correct?
Yes, sir.
Yeah, with young people, young men in particular, there's a heart condition, I don't remember what it's called, that pops up. There's all sorts of other potential side effects. And I'd say that most people will call them rare, right? They're not something that is real common.
Exceedingly rare is my understanding.
Have you assessed how many of your employees are likely to fall in that category?
Before a team member would receive the vaccine, they are asked a series of questions by the vaccine provider that would identify their contraindication for them taking the vaccine. We encourage all of our team members to speak to their doctor if they have any concerns about taking the vaccine based on any of their current medical conditions.
Sure, that's standard procedure anytime you get the vaccine. And still yet, there are a lot of people who have experienced side effects, is that correct?
My understanding is that severe side effects are exceedingly rare.
Right. Have you assessed out of the 24,000, how many people you think will end up with, because of this mandate, will end up with one of these side effects?
Hold on just a moment. Mr. Brock, could you pull your mic closer so we're hearing?
Yes, sir. Is that better?
Thank you.
Yes. Well, Senator, what we have assessed is that the risk of catching COVID-19 far outweighs any of the side effects that are remotely possible that a team member could experience. The danger of catching COVID-19 is far greater, it is our understanding, than any side effects of the vaccine.
Okay, but did you quantitate it? Did you ever actually come down with a hard number of how many serious side effects you expect out of 24,000 people?
No, sir, I don't have a number like that. What I do know is what I know is that 99% of the people that are hospitalized with severe illness are unvaccinated. What I know is that 94% in ICU are unvaccinated. What I know is that 95% of the elderly with COVID-19 in the hospitals are unvaccinated. And what I know is that we have determined that vaccination is the single most effective way to protect the health of our team members, their families, and the communities where we operate.
That's based on the therapeutic effect of the vaccination, right? I mean, you agree with Dr. Fauci and the CDC that now says that it's not likely to, I mean, maybe even not even mitigate the spread, but it certainly doesn't eliminate the spread of the virus. Is that correct?
I am aware that if a breakthrough case were to occur, that the likelihood of severe illness in that person is even far more unlikely with COVID-19.
Right, and you agree that the spread itself is, if there is any mitigation or limitation on the spread, that it's minimal. I mean, I think that all the agreed science now tends to argue that it's therapeutic, that it prevents from hospitalizations, but it doesn't. I mean, which we've seen evidence with what's happened in Massachusetts, what's going on in Israel right now, what's going on in every other place that early on did the vaccination, where they're having spikes, right? I mean, you're not arguing with that fact, correct?
The facts, as I understand, are that the vaccine is highly effective at preventing severe illness. And when the approval was given for the vaccine, it was Pfizer and Moderna were in the 90% range, and the Janssen vaccine was in the 70% range of preventing transmission or catching COVID-19.
Yeah, you would agree they're not saying that anymore, correct? That is old data, and they're not claiming that it's 90% effective to stop the spread.
Yeah, I'm not aware that they come out with a different numbers.
And we definitely need to move on, let other people do things, but